Hello friend, if you're watching this video, it's probably because you've hurt your lower back. Well, I have too. Unfortunately, I've hurt my back many times. I'll show you some MRIs. My back's probably looking worse than about any back you've ever seen. I played college football, and here I am 20 years later, just living my life, but apparently from overuse, I continue to perpetuate degenerative disc disease, which is just a fancy term for arthritis of the back, essentially. And my disc, especially my bottom two discs between L4 and L5 and L5 and S1, are just barely hanging in there. They look like I smoke in my, look like I smoked my whole life, and it went straight to my disc instead of my lungs. The rest of my discs are nice and hydrated and white on MRI, but those bottom two are black. I've done a lot of things. I've done stem cells actually injected into the disc. I have mixed feelings about that. One disc improved, the other disc looked like it maybe degenerated further. I've done PRP, which offered immediate relief. I am a fan of PRP. So if you have a doctor that can do that for you, I think it does offer relief. That's something I probably will do here in the next few weeks. Currently, I have maybe 72 hours under my belt from herniating my disc yet again. This time, I was just jumping 4 inches to grab a pull-up bar. My back had been bothering me for a few days, but when I jumped up there, it felt like an electric shock in the left side of my lower back. I've had pain in the right side of my lower back for many years. Now it's moving over to the left side, so I'm just falling apart. But anyways, long story short, I got home, sure enough, started getting lopsided, going into what's called a lateral shift, and that's where the muscles begin to lock up and try and ease the tension, where that disc is either herniated, just bulging out, or ruptured. In my case, it's most likely a small herniation, maybe rupture. I don't have any sciatica. I haven't lost any bowel control for that. I am immensely grateful. But man, the pain, it hurts to sit, it hurts to stand, it hurts to lay down. I mean, you go from being a super active person to just your entire life getting shut down and canceled. It's awful. Well, because this isn't my first rodeo, I found some things that help me get through these difficult days as quickly as possible and back onto a path of recovery. The good news is, for those of you dealing with back pain right now, is that if you can press on and get through the pain, eventually do some PT, you will probably heal up, and 90% of you are gonna be okay 6 to 12 weeks down the road. But I know it hurts right now, and it's hard to even imagine this pain for 6 to 12 weeks, but just keep pressing on, take it one day at a time. God's given us some amazing bodies, and although they are degenerating because of the fall, they can heal themselves. And so what you wanna do is you wanna support the healing process. So I wanna show you a few things that I do that have helped me heal, all right? Here's the first thing. So this is Naproxen, all right? This is a prescription non-steroid anti-inflammatory. I take 1 to 2 of these a day, 500 milligrams. It's a big help just to get that inflammation down. And the second thing is a muscle relaxer, Cyclobenzaprine, and I take 10 milligrams of that. And so muscle relaxer and a little anti-inflammatory, I take those the first few days, 1 in the morning, 1 at night, and usually gets me through the pain. The second thing I do is I immediately grab crutches, and I'm just telling you, when I'm moving around, I'm sorry, I'm quite hard to see here in this lens, but I get them underneath my arms and it forms traction. So when I just kind of hang here like this, it actually puts some nice traction on my spine. It feels so good and alleviates some of the pressure when I'm walking. So a good pair of crutches is incredibly helpful those first few days, because 1 or 2 days bed rest is good, but you don't want to stay in bed over 2 days. It's good to get moving. A body in motion stays in motion. So you got to find a way to get up out of bed and press on and just handle the pain little by little. The next thing, and if the muscle relaxer and non-steroid anti-inflammatory is not working, this is magical. It's a prednisone pack. It's a steroid. I don't like to take steroids. Unfortunately, these are not the kind that put on muscle, but they reduce all inflammation in your body. And these are like a wonder drug for me. And so if my back goes out and I get on this steroid pack, within 2 days, I feel great. And then I have to be real careful not to re-injure myself. So I always have this as a backup if I need it, but it's a last case resort. So again, a prednisone pack is a must-have if you're in severe pain, which unfortunately all of my back injuries have been completely debilitating. Now, The other thing that I do that'll help is I have a nice ice pack. This is called Elastigel. You can see it here. I just strap it onto my back, so I literally just put it on like a belt here. I'll put it on my skin directly, but for the purpose of this video, you'll get the idea. And so I'll put that on my back, you know, multiple times throughout the day, and just the ice helps reduce inflammation. Sometimes I'll take an ice bath as well. I found that that helps, but ice has been a tremendous help. And then this right here is incredible. It's called a Reg back brace. It's the best one on the markets. And what I'll do is I'll put this thing on whenever I get out of bed, and I pull these nice and tight. And what it does is it just offers some lumbar support. And it's been a tremendous help when I'm sitting in a car, when I have to sit in a car, or maybe at a meeting, or I go to work. I'll just keep this underneath my jacket or my shirt. It looks like I gained a few pounds, but it doesn't bother me because it helps just stabilize my back and give it some support. So highly recommend this back brace. Now, one other thing that I do is I try to get on what's called an anti-inflammatory diet. And that's just because I want to reduce any inflammation I can in my body and help it heal. And so 2 things that I immediately go to the grocery store, I have my wife go to the grocery store, is to grind up some turmeric and to grind up some ginger. And I usually mix this with some sort of green vegetable juice. It's the first thing I take in the morning and the last thing I take before I go to bed at night. And I feel like it just helps me tremendously get through this initial period faster so I can get on to healing. So next, what I want to show you is some exercises that I do. These are some things that I've done with many PTs over the past 2 decades. And again, they've really helped me heal up, and I hope for what it's worth, it'll help you. This first exercise I'm going to show you is called extension. It's part of the McKenzie self-correct theory. And you'll just see I'm just going to slowly go up until I feel pain, and then I'll stop. So I got to come down nice and easy because right now my back feels very vulnerable. So I come down here. I just kind of settle in, relax. Put my hands underneath my shoulders. I start coming up. The second I feel pain, I stop. Again, I breathe in and then breathe out. Once I feel pain, I stop. And eventually I do that for 5 to 15 reps. Breathe in, breathe out. And every time I feel like I get higher and higher and higher. And the theory is you can push that disc back into place. Now, if you have it on one side, pain on one side like I do, you shift to the opposite direction and you just slowly come up and relax. Breathe in, breathe out. One more time, breathe in, breathe out. There you go. Slowly come up. Now, when you're coming up, it's important not to go into flexion at any point. Flexion is like when you bend over to tie your shoes. You want to keep your back flat and an extension at all times. So stand up nice and straight. All right, so the next thing that we're going to do in addition to extension is just some very gentle traction. At no point are my feet going to leave the ground, but I'm just going to find a door frame. I'm going to grab the top of it, and I'm just going to kind of sit back slowly. And stand up. And so what I'll do is I'll continue to do that 3 to 5 times, holding it for about 15 seconds. And eventually, I just feel those discs just decompress a bit. And that's all we want. So here we go. We'll do it again. Breathe in. Breathe out. And stand. Whew. And so that little bit of traction makes all the difference in the world. You'll want to do the extension and the traction first thing when you get up in the morning, and then throughout the day. I'm going to show you one other exercise that you can do on a wall, and this is again if you have a lateral shift like I do. Now I want to show you an exercise that you can do on any wall. This is especially if you have lateral shift. Again, that happens because you have a bulge of your disc to one side, your muscles are locking down, and to relieve tension on that bulge, they're pulling you one direction. So for me, I'm being pulled to the right, and so what I want to do is I want to come up where I'm naturally leaning towards the wall. I'm just going to put my arm here about waist height. My other hand will be on my hip, and I'm just going to slowly, and again, my feet are about 6 inches apart, and I'm just going to slowly push my hips to the wall. The second I feel any pain, I stop, and then I go back to it. I breathe in, and then out. There we go. All right, one more time. Breathe in, breathe out. every time I feel like my hips are getting closer to that door, this next time I'm actually gonna try and touch it. All right, I got close, close enough. Okay, now that you've finished doing some of those back exercises that I just showed you, now I'm gonna show you what you gotta do on day 3. No later than day 3, you need to start walking, all right? Yesterday was day 2 for me. I put my back brace on and I just shuffled along and I got 1.5 miles in. Today, I just finished 2.5 miles, and tomorrow I hope to get 3. Whatever you can do, just get out there and start walking. It's gonna increase blood circulation. It's just gonna clear your mind. It's gonna get a little bit of movement back there in your lower back to help the healing. So you gotta start walking. Also, I'm very fortunate to have a pool. And what I do is in this pool, I'll literally get in that deep end, and for just 8 minutes a day, I start treading water. I just use my arms primarily, my feet just a little bit. Again, it's a form of traction. It helps you just take any weight off of that back, but it allows it to move a little bit. And all of this has helped in my healing process. So for what it's worth, walk and tread some water as soon as possible. Well, I hope some of those exercises I showed you help you find relief during this acute phase of injury. For me, usually 1, maybe 2 weeks, and then I get through this initial phase and I begin phase 2, which is a PT protocol. And I'll show you that in an upcoming video. Right now, I'm in the acute phase. It's hard for me to even stand here, so I'm gonna get off my feet and go rest. But I believe in 2 weeks, doing these protocols that I showed you, I'm gonna be in a better place. That's certainly been the case multiple times that I've hurt my back, and I hope that you'll find the same. On a final note, and this is more of a personal and pastoral note, I know that times like this can be very, very hard on you, not only physically, but mentally. And I just want to share with you 2 passages from the Bible that have helped me get through these difficult days. Because listen, one day I'm out working out, I'm competing, I'm active with my kids, I'm going where I want to go, doing what I want to do, and then all of a sudden, boom, the back goes out, and I'm in that bed for at least 12 hours a day, trying not to move because of the pain. And anyways, it hurts in every way. So I want to share with you these 2 passages that helped me. Number 1 is Psalm 34:18. It says, God is near the brokenhearted and he comforts those who mourn. You know, I serve a God who gave his life on the cross for those he loved. He was familiar with sorrows and hardship and trials. And so I pour my heart out to him, and I know he understands what I'm going through, and that brings comfort to me. Secondly, 2 Corinthians chapter 4, verse 16 says, take heart, for though this outward body is perishing, the inward man can be renewed day by day. Here's what that means. Unfortunate reality is we are degenerating. That is just part of life in a fallen world. But the good news is that we can get better on the inside. And I'll tell you, my character, my heart, my perseverance, my understanding of what I'm to do in this life and how to go about doing it, all of it is improving every day. And these difficult trials in my life, I know God is using for my good and his glory, and I believe he can do the same for you. So, principle is, cry out to God, be honest with him, ask him to heal you, and know that he's gonna sustain you through these difficult days if you keep pressing on. Do not give up. Your best days are ahead of you. I really believe that, but you gotta keep pressing on. If you have any questions whatsoever, leave them in the comments below. I'll try to respond as quick as I can, but know that I'm praying for you. I hope you get better, and I hope this video has helped you some. Be sure to stay tuned. In a few weeks' time, I'll post part of my PT protocol, and again, this has helped me heal up and have no pain and no present need for a back surgery. And that's something I hope to avoid for the rest of my life.